I'm Dr. Nina, maternal fetal medicine specialist from Teleclinic365. So, I would like to share a story with you and why we started the Teleclinic365 digital teleconsultation platform. So, over the years, I had been getting consultations over the phone, through messages, as well as through emails, and where I try to help many pregnant women as well as the pre pregnancy period and after delivery also. So then I thought there is a need to have a proper digital platform where the needy people, especially the pregnant women, will be able to have a better approach, to have a wider awareness about the high risk pregnancy cases, so that it enables them to have a more patient safety environment and to have a better outcome. So recently, I had a woman who asked me an opinion on the scan report which he had during the 20 weeks anomaly scan. So she had an anomaly scan done, which for which she was referred for further management to the fetal medicine specialist, and she was told that there is some concern in the heart of the baby, and then the baby might be suffering from some genetic or chromosomal problem like Down syndrome, and sometimes a baby may not survive, and also there is a need that sometimes she might need to have to even end up the pregnancy. So she actually got panicked, and then she contacted me through one of my friend, and then I had a detailed discussion with her. So the report basically told there is evidence of an echogenic cardiac focus in the left side of the heart, in the left ventricle of the baby's heart. So the medical people, especially the OBGYNs, would be knowing what is this echogenic cardiac focus, and even the radiologist. It is actually a small spot, a calcification spot, which happens to occur in the papillary muscle of the heart of the small baby when the baby is inside the womb. Now, the most important thing which should be understood is that it is actually considered to be a normal variation. Though in our olden days or earlier days, it was told to be one of the marker to be associated with chromosomal problems like Down syndrome babies, which means that if that finding is there in the heart of the baby, then that baby is more likely to have condition called Down syndrome or any other chromosomal problem. But in the recent studies and also the trials and evidence and research have suggested that if it is only one finding, which means it is an isolated marker, that is, if only that small calcific spot is seen, which is the echogenic cardiac focus in the left side of the heart of the baby is seen, then it will not increase. It will not increase the chance of the baby having any genetic or chromosomal problem. And then I had a detailed discussion with her. It took me a lot of time to calm her down, to reassure her that as there are no other markers seen, so it is taken only as a normal variation, because each individual is different. Similarly, each babies are different. So there could be some these subtle variations which are considered as normal variation. But the scenario changes if there were other findings, other structural problem of the baby, or some other soft markers which are major markers. And that is a role which I found is very much relevant to that pregnant woman. I was able to alleviate her anxiety so that she had a smooth pregnancy journey, and she carried the baby till full term, delivered a healthy boy baby, and the baby is doing well now. So I think it is very important that we need to practice medicine safely. Also, not to make the pregnant women, also the people, worry about the findings. So in that cases, it would be good if we are able to refer them to the expert people, the distant people who can reassure them or who can do the correct management, or as well as into the correct pathway, so that they will be able to do the needful. What is the next step to be done? As in certain other cases, certain other scenarios where there are any major problem in the scan or the 20 weeks anomaly scan, yes, definitely we need to do further evaluation, to do the genetic study of the baby, or maybe echocardiogram of the baby and all those things. But this thing is very important so that we do the correct referral, and so that it helps even the pregnant women, the doctors, as well the healthcare professional to have a better life. Thank you.